Today, I really want to focus on explaining the patient journey after sustaining a traumatic brain injury. I'm going to cover what families can expect from your loved one being admitted to the acute hospital, to being transferred to the acute rehabilitation unit, and then finally what loved ones can expect once your loved one goes home. Welcome to Fill in the Blanks podcast, where we have the difficult conversations to empower family members with knowledge and skills to navigate through a traumatic event. Today, I really want to focus on explaining the patient journey after sustaining a traumatic brain injury. I'm going to cover what families can expect from your loved one being admitted to the acute hospital, to being transferred to the acute rehabilitation unit, and then finally what loved ones can expect once your loved one goes home. So this episode is very practical. It's really about knowing what type of questions to ask the medical professionals in the acute rehabilitation and post-rehabilitation settings to ensure that your loved one comes home safely and that you can rebuild life after sustaining a traumatic brain injury. So phase 1, your loved one sustained a traumatic brain injury. They were involved in a motor vehicle accident, in a motorcycle accident, or they went abseiling and something went horrifically wrong. They are rushed to hospital, they are possibly in the ICU, and at this point in time, there's a lot of uncertainty. Often medical professionals and doctors in the beginning are not sure on the severity of the brain injury, whether it's only a concussion or a moderate or a severe traumatic brain injury. They will often not be able to give you timelines as to how long your loved one will be in hospital, what you can expect on the way forward. For now, the focus point is just to intervene medically and to stabilize your loved one physically. Family members often experience a lot of anxiety, a lot of uncertainty during this time, and during this phase, often family members are not really sure whether their loved one is going to make it or not. The second phase, if your loved one was stabilized, they were transferred to the general ward in the acute hospital. The doctors, the neurologist or neurosurgeon will then often consider acute rehabilitation or subacute rehabilitation services. So what does that actually mean? What is rehabilitation after sustaining a traumatic brain injury? So acute rehabilitation services are often focused around a multidisciplinary team approach. So it still looks like hospital, feels like hospital, but there are a lot more people involved during this phase. So often you will have your general practitioner, so your GP that will oversee your loved one's day-to-day, just general medical management to ensure that your loved one doesn't have any infection or any medical concern. Then there will be a physiotherapist. So oftentimes the physiotherapist is involved to make sure that your loved one's lungs are clean. So especially if there's a swallowing difficulty after sustaining a traumatic brain injury, they will make sure that the lungs are clean, so they do lung physio. The physiotherapist is also responsible for the mobility of your loved one. So trying to get your loved one to mobilize as effectively as possible. That tracks with what we understand what a physiotherapist does. That still tracks within this environment. Then you have an occupational therapist. So we often say the occupational therapist assists with teaching your loved one to do activities of daily living again. So they focus on strategies to help your loved one bath, dress, groom, eat, doing all the activities that they were doing before. Because after sustaining a traumatic brain injury, those things might look a little bit differently depending on where in the brain the injury occurred. The occupational therapist is often in that setting also responsible for ensuring that your loved one has the correct equipment. So they will write a motivation to the medical aid for a wheelchair, a commode, which means a chair that your loved one can toilet on or bath in, and other equipment requirements. So your occupational therapist is your go-to person for your equipment as well as your activities of daily living, getting your loved one as functional as possible again. The occupational therapist will also assist with regards to return to work rehabilitation at a later stage, but that is usually only focused on outpatient therapy. The third discipline is usually your speech and or your cognitive therapist. So often after sustaining a traumatic brain injury, a patient can have swallowing difficulty and or speech difficulty. We must also understand that the brain is the computer box telling the body what to do, but also the brain what to do. So the speech therapist will also focus on cognitive therapy. So first and foremost, they will do an evaluation to see where the mental fallouts are, if any. Usually with any form of traumatic brain injury, there will be some form of cognitive difficulty or cognitive fallout, even if it is mild, but they will test your loved one's cognition and they will continue to do cognitive therapy throughout the inpatient rehabilitation process. They also look at swallowing, whether your loved one can swallow effectively and safely after sustaining a traumatic brain injury, and if there is difficulty in swallowing, they will do therapy in trying to get your loved one to swallow as effectively as possible. One thing we do need to say with regards to the physical fallouts as well as the mental and or cognitive fallouts, every person recovers from a traumatic brain injury differently. So even during this phase, there isn't really concrete information on what the outcomes will be. At this point in time, the therapy will be introduced to your loved one, and it will all depend how they respond to therapy, what the possible outcomes are. The fourth person in your multidisciplinary team is often the social worker. I'm also a clinical social worker. I worked in neuro rehab for a long time, and I'm really passionate about the social work aspect of the rehabilitation team. So the social worker primarily is responsible to coordinate the rehabilitation process. And the social worker is responsible to assist families in ensuring that there is a safe discharge plan, meaning the social worker takes the hand of the family and they walk through this journey together to ensure that all the necessary systems are in place. So the physical environment is accessible enough for your loved one has the necessary equipment, you have taken your loved one out for weekend pass outs to see whether you are coping in the home environment. The care plan has been identified, so the social worker will often assist you with options for either home care or facility care, and the social worker ensures that those plans are put in place. The social worker is often also responsible to do practical counseling in helping loved ones adjust to life after traumatic brain injury. So they will often do practical counseling on what you can expect when you go home with your loved one, or what you can expect if your loved one has to go to a facility. Then we've got the psychologist on board. So the psychologist will often work with the patient if possible, but then also with the family with regards to ensuring that the families actually deal with the emotional impact and trauma of having their loved one sustain a traumatic brain injury. Then we also have a dietitian involved at times. So we've got a variety of people playing a role in the inpatient therapy process after sustaining a traumatic brain injury. After a TBI, the inpatient rehabilitation process often ranges between 6 to 8 to 10 weeks, depending on the severity of the condition, the medical aid, whether they are willing to authorize a specific amount of time for rehabilitation, as well as the progress that your loved one makes in inpatient rehabilitation processes. After the acute rehabilitation, this is where your loved one will go home. So we call it home reintegration. This phase is often the most challenging for both patient and families because, as I mentioned at the beginning of this podcast, that traumatic brain injury recovery is a long-term process. It doesn't end when your loved one leaves acute rehabilitation. It often needs to continue well after your loved one has left rehab. So the home reintegration is often where family members and or third-party caregivers will take responsibility for the basic care needs of the patient in the home environment, as well as continuing with the therapy program. The inpatient team will often refer to outpatient therapy to continue with physiotherapy, occupational therapy, and speech therapy if indicated on an outpatient basis. And often then family members and or care partners will have to do the day-to-day stimulation and activities under leadership of the therapeutic team. So oftentimes the home reintegration phase is extremely difficult because we are now faced with the changes physically, emotionally, socially, financially that has been brought on by your loved one sustaining a traumatic brain injury. Oftentimes, family members specifically go through a range of emotions, and in the next session, I'm going to unpack the emotional impact of a traumatic brain injury specifically on family members and what family members can do to look after themselves. I hope that this was helpful from a practical perspective to family members, that I gave you some tips on the pathway, on the roadmap, what to expect when your loved one sustained a traumatic brain injury, from acute hospitalization after sustaining the injury all the way through to taking your loved one home. This is Fill in the Blanks. This is Ilani. I'm passionate about empowering family members with the necessary skills and tools on how to navigate this difficult road after your loved one sustained a traumatic brain injury. Tune in, same time, same place next week for more information on traumatic brain injuries.